And the United States has moved to allay fears that the recently signed health cooperation framework will result in the compromise of personal health data. Speaking to Citizen TV, a U.S. Department of State official explained that the objective is to boost disease surveillance and outbreak of responses. Meanwhile, Busia County Senator Okiya Omtatah has petitioned the court to suspend the entire deal and not just the data sharing aspect. Olive Barros has that report.
The storm triggered by the signing of a health cooperation framework between the United States of America and the Republic of Kenya continues to rage as the Busia Senator and longtime courtroom activist Okiya Omtatah petitions the court to go further than suspending the data sharing part, but the agreement in its entirety. In a submission dated Tuesday, Omtatah contends that Prime Cabinet Secretary Musalia Mudavadi committed a criminal act in appending his signature to the agreement for several reasons, including that it commits public funds, and yet Parliament, in which is vested the power to appropriate, was not involved. Okiya submitting it is uncontroverted that the framework was never presented to the cabinet, never tabled before the National Assembly, and never subjected to parliamentary debate or ratification. Its signature by the first respondent was therefore an unlawful act and potentially a criminal offense. Omtatah argues that there was no public participation, describing the process as clandestine and excluding critical stakeholders, such as county governments, given health is a devolved function. Omtatah submitting to the court there was no public notice of the intent to negotiate such a far-reaching agreement, no disclosure of draft texts, no opportunity for scrutiny or comment, and no form of consultation. The full extent of the framework was only revealed after its signature. Omtatah therefore argues that it was not enough for Justice Bahati Mwamuye to suspend the transfer, sharing or dissemination of medical, epidemiological or personal health data, as he did on Wednesday last week. He argues that there is cause to suspend the cooperation framework in its entirety, pending hearing and determination of the issues raised. The U.S. government has, however, moved to address the concerns that have arisen following the December 4th signing.
The data sharing is purely done in a responsible way to ensure that no personal identifiable information is used, that we're using epidemiology information to track, detect, as well as respond to these global outbreaks.
The Consumer Federation of Kenya having moved to court to stop the sharing of this data out of concern that it may be used to profit Big Pharma.
We have always had some level of data sharing as it relates to epidemiology. We are also very clear that all data will be under the ownership of the Kenyan government, and we will comply and respect Kenya's judicial and legislative processes.
In response to the uproar sparked by the data privacy concerns, the Ministry of Health published both the MOU signed by Mudavadi and the data sharing agreement signed by Health Cabinet Secretary Aden Duale, which provides, to the maximum extent practical, Kenya shall not provide individual-level data or personally identifiable information to the U.S. government. It also provides that where there is a divergence in law or regulations as relates to data sharing, Kenya's shall prevail. Olive